Thank you, Megan. Good morning, everyone. It is 8:04. On Tuesday, September 28th. We'll call the Board of Health meeting to order. Present here today, we have Board Member Ken Laneem, Board Member Norman Weinberger, Board Member Terry Quell, and Board Member Vincent Amaruccio. And we have Health Department staff. My name is Deanna Diamore. We have Megan Fogno, Teresa Argandesi, Aniela Fignon, and Brian Weeks. Good morning, everyone.
Good morning.
Our first item on the agenda is the approval of the June 22nd, 2021 meeting minutes. Do I have a motion?
So moved.
Do I have a second?
Second.
Do we have any comments, edits, suggestions for the minutes? All in favor?
Aye.
Aye.
Any opposed? Abstentions? All right, minutes pass unanimously. Thank you. Our second item is the approval of the July 27th, 2021 meeting minutes. Do I have a motion for approval?
So moved.
Dr. Weinberger motions. A second?
Second.
Emily seconds. Any discussion, edits, suggestions?
Were there some additions that Terry had added somewhere along the line?
No, I'm not going to add them after all. Thank you, though.
Thank you.
Thanks, Ken.
No other comments?
Sorry, what was that, Ken?
Second.
Okay, second. All in favor?
Aye.
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 Any abstentions? Any? Okay, all in favor, approved. All right, the next item on the agenda is the director's report. So just some updates. So last week, the Lieutenant Governor visited Norwalk to do a press conference to highlight the work that Norwalk has been doing, the successes with vaccination and COVID response. So it went really well. It was really nice to see that recognition from the state, and Lieutenant Governor is always really supportive of Norwalk. So it was great to hear some of those highlights, and we got to share some of the amazing work being conducted by the Vaccine Equity Partnership, which we'll highlight later on. So we can talk about all the successes that occurred over the summer, but that was really great to get that recognition. And to also talk about the governor's executive powers and the need to extend them to continue to address emerging needs with the pandemic. We also had a meeting, Norwalk Hospital had their community health committee meeting this past month. And we talked about the update for the community health assessment and the community health improvement plan. And so over the next year, there's going to be updates to the community health assessment. Data Haven, as you know, has been doing the community well-being index across the state. There are surveys in Norwalk and in our region. So that's, sort of the beginning of the update of the community health assessment. But we're looking forward to getting that work continuing and going again. So we'll keep you updated as that moves along. But right now, it's just the preliminary start of the community health assessment. And in the months ahead, we're going to be collecting more data, more information, and engaging the community and updating the community health improvement plan.
And are you working with people that are local Norwalk Hospital people, or is it more the corporate side of Nuvance that's driving that?
So it's sort of both. I mean, it is the corporate end that they're looking to, have consistencies in the approach for the community health assessment, but there are representatives from Norwalk Hospital as well on the community health committee. And there are several community health partners that are working on it as well, and that are represented in that committee. Do
you have a list of the participants in that meeting? I think it's an important, really important meeting, and it's an important outcome related to what we do. We want to make sure that I always like to make sure that we're not left out. Let's put it that way. So if you could give me that list, I'd appreciate it.
Yeah, we'll do that. We do have both Norwalk Community Health Center and Community Health Centers Inc. who are on there, as well as AmeriCares and some others, but I will send you the complete list for sure. We're also Aniela has started to, if you recall, when we last updated our strategic plan, we did an environmental scan where we looked at the recent community health data. We looked at some other, emerging issues across the country. We looked at the workforce needs. And so Aniela is starting to look at what we did in the past and think about, as we update our strategic plan, which we need to do, what's that going to look like? So she's starting to formulate some of that, and we're hoping to get that updated this year as well in sync with the community health assessment. We're also working on, the state health department requires us to submit an annual report updating, where we are with meeting the 10 essential public health services, as well as just general information about our department. So Aniela and Megan and I are going to be working on updating that. The last time around, it was the first time where we actually submitted documentation to show that we were meeting the 10 essential services. And there was a work group with local health representatives, as well as the State Department of Health, to formulate what that would look like. And so the last time around, we submitted all our documents. There was just one suggestion that the state had, like updating one of our review dates on a policy. Like, it was really simple, minor thing. So we think we're in a good place to just submit an update, updated documents for this year. So we're working on that. That's not due for another month or so, but we're working on that. And then also there were some updates to state statutes related to municipal and district health departments in this session. And the state health department sent around a summary of some of those updates. But as you recall, there was an increase in per capita for funding for municipal health departments from $1.18 to $1.93 per capita. And there's also some changes there. They're trying to just make things consistent between district health departments and municipal health departments. You may know that the state statutes governing municipal and district, they're different. They're different sections of the state statute. So in the past, district health directors had to be approved by the state health commissioner. And whereas municipal, it was just, you had to send your appointed, the mayor and the common council's appointment, and the commissioner had to review it, but it wasn't like an approval process. But now they changed the state statute to require the state health commissioner's approval for the appointment of municipal health directors to be consistent with what they do for district health departments. There's some language that prohibits municipal health directors from having a financial interest or engaging in a job, transaction, or professional activity that would substantially conflict with their director's duties. That's something that had always been in the district health department statutes, but they added it to the municipal health directors. It talks about having the municipality having an agreement with their director to the state health department. And it talks about some other things like changes about minimum vacancies of a municipal health director from 30 to 60 days before the DPH commissioner may appoint someone to fill the vacancy. So there's some changes that were made. And so I can send those all to you so you can see them. I sent them to the mayor and the personnel director for their reference, so they have them all.
Does that have to be approved by the common council, or is that just something that is approved locally and then submitted to a state level?
The appointment of the director, or
Yep.
or these changes that were made?
Well, I think those changes are going to become part of what has to be adopted in Norwalk. So I guess that whole thing has to go through the common council, right?
Yeah, so the appointment has also been defined in our own local ordinances. And so it's been that the mayor appoints and the common council has to vote on the appointment. So the common council can agree or disagree. So like both have to happen, and then it gets sent, I believe, to the state for the final approval. So yeah, where in the step does it happen? Still not exactly sure. So I'll clarify that with the state health department, but yep, it'll have to be adopted into our own local process.
Now you're part of the bureaucracy and not just watching from the outside. Huh?
Yeah. And so also just wanted to mention that we're participating in a workforce development survey. So in the past, we've done different methods for assessing our workforce. Where are we with professional development? What are our interests? How do our competency, like what level do we exhibit with the core competencies of public health? And so we're doing a new survey this year that the De Beaumont Foundation has put together. It's a public health win survey. And so it's it's gonna help us really. We'll get a summary of the results. We're not gonna see what each staff person says, line by line. It's all confidential, but we'll know how our employee, like in terms of how to guide our workforce development. So I don't know if Megan, you're able to give like a quick update, but it looks at our workforce knowledge, skills, and attitudes, key issues that are affecting our workforce morale, training needs, worker empowerment, any emerging trends in public health and demographic characteristics of the workforce. Megan, I don't know if you have anything to add to that, but we're excited to participate.
Yeah, excited to participate. It launches this week. And so staff will be getting the survey via email. We've worked with our IT department to ensure that nobody will get it blocked so everybody can participate. It's crucial to have, the majority of the staff participate so we have some good data to guide our work. They're also going to ask a few questions related to like your work around COVID and how have things changed, and so we'll be able to, see some of that information, which will be helpful as well. So we're really looking forward to this. It was really a minimal amount of work on our end. We just had to do some logistical stuff, give them a spreadsheet with the information that they needed, but it was, they've really made it very easy for our local health departments to participate. So I want to thank them because it's going to be some great information that we'll be able to get out.
Is that something that we initiated on ourselves, or is that something that someone else sponsored and we're providing that information to them to aggregate it somehow?
So they're leading it. They're going to summarize all the information for us. It's led by them, and they're going to, by us participating, then we'll get the summary of all of it. So they're doing all the legwork for us.
Who is them? Who is them?
The Beaumont Foundation, in partnership with the Association of State and Territorial Health Officials. And so it's completely voluntary. The staff don't have to participate in it, but we're hoping they will, so that it can help guide our overall workforce efforts.
Yeah, I didn't know whether that type of thing was built coming out of our strategic plan. Because that's certainly stuff that we will need to know to help set, where the guidance of that is going to go. So I didn't know if this was something, because we're the number of workforce development initiatives that are going on in the state right now is enormous. We're doing one statewide, CHA is doing one, because everybody's looking at workforce, and it's becoming a critical issue in the health centers. I know that. So I just didn't know where it was being sponsored from and who's going to own the data and how does it get used.
So we're absolutely right. This will be one of the, I mentioned the environmental scan for the strategic plan. Like, this will be one of those things that we incorporate into thinking about, where are we moving forward with our strategic plan? How do we use these results to inform our next revised workforce development plan? You may remember that, when we had in-person staff meetings, we used to have trainings every other month. So that's where we're going with this, is to be able to identify, the direction, like where we want to, how do we want to build our staff collectively across the department to keep, moving us forward? And also thinking about what are the interests of staff too, right? What are their own personal interests, and how do we develop staff and keep them engaged and keep them wanting to be here?
So the data that comes out of this is yours, is the health department's data? Who owns the output?
So I want to.
Okay, go ahead.
They own it, but they're sharing it with us so that we'll be able to utilize it, in-house for what we need.
Are you going to be including the emergency response team? I know they're volunteers, but just a curiosity whether or not they would be included.
We've thought about that, and so one of the things is it seems very focused on even workforce morale and working through, trends in public health. So we've thought about that. We thought about doing our staff first, and then once we have the final survey, then we can take pieces of that and then we would run it ourselves and everything would be ours. And then we could, put into a survey form for the volunteers, both And we thought about like with our community health workers too, right? We have a close partnership with the Family and Children's Agency, you know, what are they interested in learning too? So we thought about do it with our staff first, and then once we have the final product, then we can see about utilizing it with different groups. But that's a great idea, Terry, even other interns too that we work with.
Sounds good.
All right, so those are my updates. We're gonna move next with COVID-19 updates. I'm gonna pass it on to Brian to give his presentation, and then we'll provide additional COVID updates after him. Good morning, Brian.
Hey, good morning, everybody. Here, let me just share my screen. Jump right into it. All righty. So hopefully it should be popping up on the screen. All right, there we go. So hey, everybody, Brian Weeks here, epidemiologist at the Norwalk Health Department. What you're seeing on your screen right off the bat is the CDC community levels of transmission by county for the last 7 days. This is kind of one of the de facto measures that we're using to just obviously monitor COVID status by county for the country, but also for Connecticut, and subsequently also informing the face mask mandate that we'll actually get into a little bit later. So as you can see, majority of the country is still in the high, so actually 94.6%. And so pretty good proportion of that, as you can see, as it's pretty much a red palette in terms of color. But if you look at the state of Connecticut, you can see how a large number of counties actually have now entered the substantial or second highest category, the orange category. So you have, 5 of them out of the 8 in the orange level, including Fairfield County. So it's, great news. But again, with COVID, things are jumping around in terms of, being in the red, being in the orange, and kind of, back and forth. And so just keeping that in mind. But nonetheless, this is good news to see for the beginning of this week. And so moving forward, what has again been driving all this, and we're very well aware it's the Delta variant. This has come from the CDC in terms of their nowcast model, which is again essentially the forecasting model for the variants. And you can see how Delta, which is the orange here, has been really running that show. I mean, really kind of pushing out the other variants of interest and concern. And obviously being monitored by the CDC, and you can look at it from a regional perspective too. All majority pretty much in the orange. So if you look at it and you tally it up for Delta, it's about 98.6 of all those cases that are popping up in the country. Now, looking at it from the state health department's perspective, this is data going from March 2nd to September 20th. Again, you can see the same kind of proof in the pudding in terms of Delta running the show. Delta's in the red. Alpha was in the black, but Alpha was the UK variant, but obviously quickly got overrun by Delta, which was much more transmissible. And so we're seeing that obviously reflected in the state of Connecticut again, with just Delta running that show. Now, kind of going more into outcomes and just measures that we're using to surveil relative to COVID and the variants. State does provide data relative to hospitalizations associated with COVID. And so you can see this data actually up to the 28th. And so you could see that for the most recent data point, which was yesterday evening, it's 264, COVID hospitalizations for the entire state. And so obviously much better than where we were just even a few weeks ago, where we were at 391 and concerned with the steep curve that was keep going up and mimic kind of like what we had back in April. But very fortunately, it seems to be the impact of messaging, face mask mandates, and obviously vaccination efforts, especially in lieu of school starting, that really kind of helped, tamper things down at the moment. And again, I always use the analogy that, we're definitely not out of the woods, and, it's a bit of a tinderbox. I mean, if you do have the perfect conditions, if people let their guard down in terms of protective measures and other things too, or have a new variant enter the mix, that could very well change very quickly. For the worse. And so it's just very important to keep that in mind. We got to be very vigilant, especially as you've probably been feeling lately, the weather's been much cooler than usual. So less opportunities to social distance outdoors, soon enough. So it's important to keep in mind too. So looking at for the town and city case rates for COVID-19, the most recent surveillance time period, September 5 to the 18th. For, the state of Connecticut, you can see how Norwalk is in the orange. We're at 11.7 cases per 100,000, where, obviously it's much more in the yellow and orange for, the southwestern portion of the state versus obviously if you look at the northeastern portion, which doesn't have as great vaccination numbers as the southwestern portion. So you can see how their case rates still remain high. I think that's an important point to emphasize too for the state of Connecticut. But again, we're not where we were about, a little bit over 4 months ago. And then also, about 5 months ago where we were, fortunately, we're not at that level. Even though it seemed like we were closely approaching it, where we were at 24.5 cases per 100,000. And again, that's, mid to late April. So then looking at it from, again, just comparison perspective, comparing us to the other big 6 Connecticut cities. Fortunately, Norwalk's, actually one of the lower case rates, again, 11.7, but, we're definitely not at the level of, say, Hartford or Waterbury at 22.7 and 20.7. The lowest being 9.7 in Danbury. But, we're very close. So I thought that was really kind of a great thing to see. But again, with COVID, obviously it ebbs and flows. So we have to keep that in mind. But we're currently at a percent positivity of 3.5%. Keeping in mind that, again, there's always a lag period with getting this data when it comes to surveillance data and data quality. So this is reflective of September 5th to the 18th. For, the total number of cases relative to the entirety of the pandemic, are 12,490 cases, 235 deaths. What's really interesting here is, this is just the most recent kind of surveillance period of September 12th to the 25th for Norwalk cases. You can see the age demographics and the proportions kind of shifted. We're used to usually seeing 20 to 29 and 30 to 39 usually being the highest in terms of proportion, but shifted actually just recently to 40 to 49 and 50 to 59 at 18.4% and 17.5% respectively. And then also kind of equally at third place, 13.6% for 0 to 9 or less than 10 years of age and 20 to 29. So we find this kind of interesting. It is, given the various circumstances we have seen potentially related partially to schools and young families, having COVID and, one or the other kind of exposing each other. And that's kind of what this is somewhat tied to. We're having a lot of obviously household, outbreaks or clusters, if you want to qualify it that way. And so it's just important, whoever does bring it in, obviously monitoring their conditions as much as they can, obviously reducing the opportunities to be exposed to the virus, but subsequently not exposing others as quickly as it can. But, obviously the attack rate's pretty high in the household once, it's pretty much since this Delta enters the household. So that's also kind of the other issue and why we're seeing kind of this residual, so to speak, in terms of activity. But nonetheless, it's obviously showing the slow downtrend that we are currently experiencing, even for the whole state of Connecticut, but also Fairfield County and subsequently the city. But again, anything could change it. So let's not let our guard down. And so just keep in mind vaccination, this is just another important thing in terms of initiated vaccination, which is getting at least 1 dose of the vaccine and fully vaccinated, getting the complete series. And so for all ages, which includes ineligible age groups, the city of Norwalk for initiated vaccination is at 73.98%, which is really phenomenal. It's higher than obviously the state level and, majority of towns and cities in the state itself. And then for fully vaccinated, 67.37. So obviously, what it suggests still ways to go, but still better than the state and also a majority of towns and cities in the state of Connecticut. So it's really great news. And fortunately, we also have that kind of insular protection, so to speak, given that we're in the southwestern portion of the state, which has better vaccinations overall. We're in a better place than, say, again, the northeastern part of the state. So it's really great news, and if you kind of look at the age breakdowns that's supplied by the state health department, you can see that for 18 to 24 and 25 to 44, they're still a little bit lower in comparison to the other age groupings. And so there's still obviously opportunity to really reach out to them along with everybody else to get everybody else vaccinated. But nonetheless, it seems like there's a little bit more opportunity in terms of outreach. So just putting that on everybody's radar. And so also what's really cool is the state health department has been, promoting these kind of weekly assessments. So these numbers change. But, they're looking at it from obviously infection rate, from COVID-19 deaths and COVID-19 hospitalizations. And so they've done a comparison of those unvaccinated versus those fully vaccinated. So if you're unvaccinated, you're at 5 times higher risk of COVID-19 infection versus those that are fully vaccinated, 6 times higher risk of COVID-19 death, and 13 times higher risk of COVID-19 hospitalization. Again, these numbers jump around because they're looking at it from a week-to-week basis, but I just thought it just really emphasized the point: get vaccinated and fully vaccinated too. Don't just get the one shot if you're getting an mRNA vaccine series. Just do the whole thing, follow the rules, and obviously with these new rules with vaccination, just making sure that you're obviously following those regimens. And so the other thing that I wanted to kind of just refresh everybody's memory about. And obviously we've heard a lot about this, and we've obviously hopefully employed it in our various activities, especially in public indoor settings. But just a reminder for face masks, making sure that, the CDC keeps changing their infographics. So I thought it'd be also helpful to kind of share this again. And so make sure that if you're wearing, cloth or fabric face mask, that it has at least 2 layers, and, make sure it's obviously washable. You clean it, follow kind of the general protocol for that, especially if you're buying it from a manufacturer and things of that nature. Make sure it completely covers your nose and mouth, fits snugly, really important because you don't want to have air leakage. Having a nose wire that helps also prevent that leakage from the upper part of the bridge of the nose is really important. Make sure it's not made from materials that you just can't breathe in, because nobody wants to suffocate. that's I think pretty obvious there, but just making sure people realize that. Don't wear something that's vinyl or just completely impenetrable in terms of air, and so you can't breathe. Making sure it doesn't have any valves or vents, right? This is a big issue because, as you'll see here, this bottom right infographic, this little GIF, you'll see that somebody that does have a vent, it's basically a projectile. So here, actually, if I just jump from the screen and jump back, you can see how it's literally like a missile of air. So what it might do is obviously filter the air for you, but it's not filtering the air for others if you're potentially at risk of asymptomatic or symptomatic presentation and, transmitting the virus. You're very high risk of exposing others. So it's not recommended. I mean, if you do have to wear this, then you wear at least a surgical mask over it to protect and filter that valve. And so that's an important point. And then over here on the right-hand side, this guy's not going Super Saiyan. Essentially what it looks like and what it should indicate to you, this is regular breathing in terms of just what filtration would occur, and also the risk and directional flow of air for somebody that would be potentially transmitting the virus, or obviously at risk of exposure too, if relative to inhalation. But as you can see with him, this individual wearing an N95 mask, you don't see that airflow, that directional airflow. So there's less risk of exposure to others. And obviously it has that filtration capability with an N95, right? 95%, particulate filtration. So it's really important just to emphasize that point. And it's nice to see these visuals from these various studies, whether it's from manufacturers, and this one below is from actual nature study, but it's just an important point. And so also this emphasizes the other point too, with face shields. They don't provide any filtration. Obviously they're helpful, especially in terms of especially healthcare providers in managing, droplets that might be produced from various procedures. But again, that's supplemental to actually wearing the appropriate face mask. And in that setting, definitely an N95 at minimum. So, just emphasizing that point. So, again, valves are just, very risky to the public. It's not recommended. If you go in a hospital, they're going to have you switch those face masks to something else, or at least cover up the valve and make sure it's covered at all times, because you see it's like a projectile there. And so, again, how to wear the face mask correctly. These are pretty much no-brainers. Make sure it's, over your nose and under your chin, right? You want to have that full coverage. You want to make sure there's no air leakage, and especially if you're wearing an N95. You might want to seek out fit testing, because that's really the better way to know if it's making an appropriate fit and finding the right N95 for you. And then also, keep in mind that, when you're hanging around your neck, your head, if you're hanging on on only one loop of your ears, just cover your nose, just cover your mouth. Obviously not adequate filtration, right? You breathe out of and exhale out of either your nose and mouth and or mouth. So it's really important to keep that in mind. As basic as that sounds, I see a lot of people, especially in their occupations, not wearing the appropriate face mask, first of all, but secondly, also, just covering their mouth, not so much their nose. And it's got to be consistently, obviously, both the nose and mouth. So just knowing the different type of face masks just very quickly. Obviously, we probably already remember this. It's more for the general public, but, surgical masks are, obviously somewhat of a better alternative to the cloth face masks. And obviously, if you're wearing a cloth face mask, as outlined before, make sure you layer it. The better one is obviously the KN95s or the N95 respirators, and making sure they're obviously not counterfeit. That's another big issue, and you should check not only the labeling to make sure what it's labeled to be and capable of filtrating, but also just checking on the web, making sure it's not a manufacturer that might have lost their credentials or credibility in terms of the ability to filtrate, because there's also, a lot of counterfeit ones. And so, excuse me. So as you can see here, the surgical face mask, just another way of looking at it. These are, the KN95s, the ones that kind of make you look like a bird. And then, your N95 face mask. And again, don't use the ones with the valves, or if you have to use it in last ditch effort, make sure it has another mask over it that does filter that valve, air. So again, that would be like a surgical mask over it. So just want to emphasize those points and just make sure everybody's familiar with, the type of face mask options out there. So that kind of just leads me to my other point. We do have a local executive order for the city of Norwalk that was effective on Friday, August 13th, along with obviously adhering to, the governor's executive orders, including, number 13A. And it's following obviously the CDC county transmission levels that we talked about in the first slide. And, we're still in the orange. So substantial and high categories still qualify as, kind of leading and directing this local executive order. We'll see how things kind of move forward. If it obviously gets worse, stays stable, or obviously gets better, and evaluate accordingly. So this executive order applies to all indoor public settings. So just really important to keep that in mind. And this is just the web link if you want to take a look at the language a little bit more as that, the public press release and things of that nature. So the other thing I want to emphasize, in the midst of all this, even with COVID activity seemingly decreasing, it's still important to monitor yourself for symptoms. Again, colder weather is going to increase opportunities for other respiratory illnesses as well. So we need to triage those ASAP so we know whether it's COVID or something else. Keep in mind when somebody's exposed to COVID, that it can take up to 2 to 14 days for them to present with symptoms if they become symptomatic at all, right? We still have the big issue with asymptomatic presentation. And again, this also applies to somebody that's even fully vaccinated, monitoring their condition as well, but following obviously different protocol for that, especially in the context of quarantine. But, just again, keep in mind the various symptoms associated with COVID, because they could be very general. So again, fever, chills, that's more obvious, cough, shortness of breath, or difficulty breathing. But then you have general things like fatigue/malaise, muscle or body aches, headache, new loss of taste and smell, which is obviously one of the better indicators, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So just keep in mind when we talk about fatigue or headache, it's unexplained, right? I mean, or muscle and body ache. So if you just ran a marathon the day before and you don't usually run marathons, your muscles ache, more likely it's linked to that than it is COVID. But if you want to err on the side of caution, we don't obviously deter you from seeking testing and the appropriate testing. So another kind of blatantly obvious thing, just making sure everybody's aware, PCR testing is the optimal test and the gold standard for somebody that's symptomatic or asymptomatic. Rapid testing or antigen testing and even rapid molecular tests, which, like CVS and some other pharmacies offer, they're only really appropriate for, say, the first 4 or 5 days of symptoms. So just keep that in mind. Otherwise, you really should just get the PCR test. And if you want to save the headache, just get the PCR test, obviously working within your insurance and other requirements too. But PCR test will obviously give a better and more reliable result. That's, again, for the general public. And where you can seek testing, City of Norwalk testing website, you can check out this link, norwalkt.org/testing, or the 201 website. But from a publicly endorsed site, that's been coordinated with the City of Norwalk and the State Health Department. There's the Rotman Middle School site, 201 Highland Ave. 5 days a week, Monday, Wednesdays, Thursdays, Saturday, Sunday. This is a great site to go to, and it does the PCR test and, also has electronic capability to access results. Just get tested. That's what we want to do. If you have symptoms, we want to be able to weed that out. Don't go to work. Don't go to school. Please don't put other people at risk. Take that time to get that test and just know your status before you return back, right? It's one thing to, obviously do this, but also make sure that while you're waiting for your results, not to show up at these places, because you might find out and then you're already there and then there's already exposure situation potentially. So really important. So if you want to learn more about, anything else that we try to really emphasize, check out our weekly report. It's on obviously our city webpage, but also the city's social media, which is Twitter and Facebook as well. Check it out. It's much more comprehensive than even what I'm talking about here, but addresses everything that, you might have questions about COVID. And if you think of anything we could include in there, by all means, let us know. So also on top of this, I think it's also important to keep in mind flu surveillance, right? Because we are, in the midst of flu season, just in the very early stages of it. And with various kind of face mask adherence nationally, you're going to have different levels of flu as well playing into the mix compared to where we were before in 2020 dealing with COVID, and everybody was really kind of shut down or wearing face masks, and flu more or less was not really present. We're hoping that, it doesn't present itself, but, the odds are high. And as you can see here from the CDC, this is going up to September 18th for that week. You can see how, again, the South and kind of like, these portions of a little bit further from the Eastern Seaboard, you have these other states like even Virginia that do have some level of flu activity. So that also complicates diagnosis, but also, it's just another, infectious disease in the mix that we don't want. Connecticut's obviously at like the lowest level, so we're in a very good position, but just emphasizing that could always change, especially our proximity to high population density areas such as New York, New Jersey, Massachusetts. So just really important to keep that in mind that, flu is in the mix and very much present. And then also changing gears a little bit, mosquito surveillance, again, fortunately, this hasn't changed too much from the previous week. But for our own knowledge, as you can see here from the surveillance from the Connecticut Agricultural Experimental Station, really the southwestern portion of the state has the majority of the mosquito activity that has tested positive for West Nile virus. Norwalk is no exception. We have 9 pools that have tested positive. And the state of Connecticut has 3 West Nile virus positive human cases thus far. So that is Bridgeport, Hartford, and West Haven. So just those little red people that you see here on the chart, just for people to visualize it. But it's really important to keep in mind that this is still something else out in the mix, especially when we're encouraging everybody to social distance outdoors. And then there's mosquitoes out and about, and I've been seeing tons of them outdoors. So just keep that in mind. And that's not really going to go away until we get our first frost, which still has some time till we get there. So it's important just to really follow that so we ride out the season and not complicate anything else with even more infectious diseases in the mix. But yeah, that is my summary for just the general items. I will open up to any questions. Thanks.
Thank you so much, Brian. Amazing job as always. Does anybody have any questions?
Very comprehensive.
I still can't believe we have an epidemiologist and we have Brian. He's amazing. I feel so fortunate. Thank you, Brian. Wanted to give some updates about just general vaccination, and Megan and Teresa jump in if you have anything to add. But overall, you'll remember we began vaccinating back in December of 2020, starting with those in phase 1A, the healthcare workers and the medical first responders. We've offered dozens of clinics at many sites throughout the community, including the senior center, the schools, churches, the movie theater, Botai, now the Maritime Aquarium. We've administered over 12,000 doses, 12,490. We've had more than, Terry mentioned the emergency response team. We've had more than 200 active volunteers working at our clinics, food distribution sites, and other activities. Most recent activity has been focused on vaccine equity. The state funded, you remember the state funded us, as well as the Norwalk Community Health Center, Community Health Centers, Inc., and FCA, the Family and Children's Agency. And we've had other partners throughout this, the schools, businesses, nonprofit agencies. Collectively, all of us, we've had more than 100 community, mobile clinics held over the summer, administered more than 4,000 doses as part of these efforts, more than 130 at-home vaccinations. And in August, the community health workers at the Family and Children's Agency knocked on more than 1,100 doors to get the word out about vaccines, clinics, community resources, mental health support, and other health education information. Now our work continues. So the state offered a no-cost extension to that grant. If you remember, it was supposed to end at the end of August. And so now it's going to continue until December. And so Megan, as part of some of that effort, Megan joined Norwalk Community Health Center for the Center for Youth Leadership at Brian McMahon and Norwalk Acts for a youth town hall to provide information and answer questions about the vaccine. Megan, anything you want to share related to that town hall?
It was great working with the students. Me and Teresa had worked with them probably a month prior to help them develop some social media campaigns so that they could promote, getting vaccinated to the rest of the youth in Norwalk. So it was great to see those students again, and the interviews were really, really nice. And it was, other students that are interested in, public health as a major and as a career joined to listen. We talked a little bit about, working in public health and getting your, undergrad and master's in public health. So it was really nice just to share the work we do in our education with the youth of Norwalk.
Thank you, Megan. So while this equity work has been extended, some of the activities are going to slow down a little bit, but there are going to be some more mobile clinics and homebound vaccinations from Community Health Centers Inc. that are going to continue until the end of the calendar year. You might remember some other work. The health department worked with FCA and the State Office of Health Strategy to secure additional funding to extend the Family and Children Agency community health workers' time for another 2 years. So they're going to continue working on outreach and education about COVID precautions and vaccination, as well as connection to community resources for those who are struggling because of COVID, if they have food needs, housing, utility assistance. And then we also have a state grant. It's extending some of our IAP work we're going to be able to hire 3 additional community health workers to do similar work in our area, as well as the Danbury region. So just want to applaud Teresa and Megan and everyone else, Darlene, the whole team really, for all that they're working on, our emergency response team, our parent staff, to continue getting the vaccine out into the community. A lot of great strategies, providing materials in multiple languages, staffing clinics with multilingual community health workers, staff and volunteers, doing consistent clinic sites, as well as pop-up locations, evening and weekend hours, embedding clinics at community-based locations. I mean, there's so many different strategies. And then Brian was really helpful summarizing the state and local data so that we can target outreach and the vaccine clinic locations. So really great work, team. Anything to add, Teresa or Megan?
Nothing to add, just looking forward to continuing the work.
Actually, we actually, the Health Center Association just got a grant from HRSA to hire 8 additional community health workers around the state. I might put them in touch with you guys so we, in case there's a focused area that needs some extra support. We're going to be spreading this groups around the state where the high hotspots are. So I'll connect you guys, and in case that's something that you can work with.
Oh, that's great. Thank you, Ken. That would be amazing. In terms of vaccination moving forward, I'm just going to pass it on to Megan just to talk a little, and Teresa, about our future plans. This week is our last clinic at the Maritime.
Yeah. Teresa, I'll take it away, and then if you want to add, so anything I missed. So like Deanna mentioned, this week is our last week at the Maritime Center. We're still offering Moderna and Pfizer first doses. Anybody who comes in for a first dose, who came in, a couple weeks ago, they'll be coming to the health department to receive their second dose from us. Let me just see what else. So again, tomorrow's the last night there, but we'll be continuing to offer those second doses. Anybody who is unable, so it might have been, trouble to get to the health department on the other side of town, we are partnering with CHC Inc. to do any home visits for, to get that second dose into them. Right now, I don't think anybody needed that. They're all able to get to the health department. That's
Thank you, Megan. And then Teresa, can you give us an update on boosters?
Sure. So as you all probably saw in the news late last week, the various authorizing agencies at the federal level approved the Pfizer BioNTech vaccine whose brand name I will not try to pronounce right now, for boosters for certain populations. And so based on that authorization from the FDA and then recommendations from the CDC, people who are, there are 2 groups of people the CDC recommends to get a booster shot with Pfizer. And those are people 65 years and older, and people who are ages 50 to 64 who have certain underlying medical conditions that put them at higher risk for serious disease. And in these groups, they must be folks who got Pfizer for their first primary series. So their first and second doses were Pfizer, and the second dose was 6 months or more ago. So those folks are recommended to get a booster. For people in 2 other groups, the CDC suggests that they may get the vaccine, but they should consult their healthcare provider, consider their own individual circumstances, and really weigh the cost benefit analysis for themselves, and then make a decision as to whether or not they want a booster. And those 2 groups of people are folks ages 18 to 49 with underlying medical conditions that put them at higher risk of COVID, and then folks 18 to 64 who may work or live in a setting that puts them at high risk of exposure to COVID. So those groups of folks may be at a little bit higher risk for serious COVID or increased exposure risk, and so they can weigh the benefits and the risks associated with the booster to decide if they want to get it. So most of the providers in our area that are offering, all of the providers in our area that offer Pfizer that we're aware of are giving boosters at this time. So that includes the mobile clinics around the city, but really the best place for individuals who got Pfizer their first time around and are eligible and want to get a booster now, the best place for them to really go, and what we're trying to get the word out about, is the retailers in our area. So the pharmacies, mostly pharmacies, some urgent cares, some supermarkets that are offering the vaccine. By making an appointment with those spots, you can make sure that you're going at a time that's convenient for you. You can make sure that the inventory is there. Some of our mobile clinics don't take appointments, and so we can't guarantee that there'll be vaccine there when you need it. So we're really encouraging people to go to covidvaccinefinder.ct.gov, which is a statewide search engine to find providers who offer the vaccine, and schedule an appointment at a local provider. And what we're finding is that there is plenty of capacity at these locations. And so if someone got Pfizer first time around and they're 6 months out and they're looking for a booster, they should be able to find an appointment really easily at one of these locations. For individuals that got Moderna or Johnson & Johnson the first time around, we're just asking everybody to sit tight, and we're awaiting more information. We expect, just like the first round of approvals and authorizations, that Moderna and Johnson & Johnson will be, collecting and presenting research data based on what they're finding related to boosters. And if approvals or authorizations come out for those 2 brands, we'll be sure to get that information out to the public. But for now, these booster doses are only for the folks who got Pfizer first time around. For individuals who have immune compromised conditions who got Moderna or Pfizer, they've been eligible to get a 3rd dose for a few weeks now, and most of the places that offer Moderna and Pfizer can offer those 3rd doses for those folks as well. But it's a very small population of folks who have specific immune compromised conditions, and there's information about those folks on our website as well. I think that's all for boosters.
That was a great update, Teresa. Thank you. Any questions related to that?
Dan, are you gonna touch base on mandates for your staff?
So the mayor has implemented mandates for, he's implemented required vaccination, and if you're not vaccinated, to do weekly testing to present a negative COVID test. And so they're collecting all that information right now, the personnel department, on all the employees, and they're going to be following up with next steps for submitting, the negative test results on a weekly basis. So something I just wanted to add to that, thank you, kind of jogs my memory. So after we spoke at previous Board of Health meetings about masks and some vaccination, I did reach out to the mayor and share with him all the feedback that you had been provided, all your perspectives, and he's very interested in hearing what you as professionals and the experts had to say. So wanted to thank you all for all your insights and your your thoughts and your advice and your guidance.
Deanna, could I, were you planning to talk about flu at all, or would you like me to?
Yeah, we are. Yeah,
Okay, cool.
Megan's going to give a reaccreditation update, and then we'll go into flu.
Sounds good. Thank you.
Thanks, Teresa.
Teresa, I have some of the flu information as well.
All right, passing it to you, Megan, to do reaccreditation.
Yes, so we're here. Our deadline for responding for our pre-site visit for reaccreditation is October 16th. And so as you guys remember, every 5 years for accreditation, we have to reapply for reaccreditation. So back in 2019, we submitted all of our documentation to show how we met for reaccreditation. After that, FAB reviewed, did a site or pre-site visit review of all of our documentation, and then they went through and opened different measures that they felt we either didn't meet or there was some element of it missing. And so out of all the measures, there was 22 that were reopened. Throughout this whole time since 2019, FAB has updated some of their guidance. And so out of those measures, 7 of them were met with missing now, which means that they actually did meet, but they might be missing one element, but we could not respond to those and they would still be counted as met. We are still responding to those because it's a small little piece that might need to be tweaked. And so we're responding to those measures as well so that they're fully met. And then out of those 22, seven are met with missing, 7 are ready to be uploaded. And then we're still working on about 8 of those other measures. And again, some of those, since FAB has updated their guidance, some of those measures that they felt might be outside of scope, out of scope for them are now in scope. So some of the measures that we've already submitted actually did meet. So we didn't necessarily have to go back and give new examples. Another thing with reaccreditation, the first round with regular accreditation, you would have to actually upload a lot of examples, so scanned in reports or scanned in meeting minutes to show. But really for reaccreditation, it's all about narrative writing. So thanks to Aniela, she's been a great writer and assisting us a lot with some of those measures that we've had to rewrite certain elements of that. So we don't necessarily need to pull up all these old documents, but it's really just talking about the work we're doing. So that does make it, I want to say, a little bit easier because we can really just, think about things that we've done and then write about them. So again, we've already submitted most of them during the initial phase. And so now it's just really responding to any questions kind of they might have on some of the measures or clarifying certain things. And so we're working very hard on that. All of our staff, as you know, participate in reaccreditation. So we have measures from across the department. So everybody, besides all this great work we've talked about today, is also doing reaccreditation work as well. So I just want to thank the entire team for everybody, all the support.
Thank you, Megan. And then can you give your update about flu?
I don't know, I muted. So flu season is here. We're going to be hosting our community clinics like we do every year. Last year we did a drive-through. This year we're doing kind of back to our community clinics. We're hosting 2 of them. Tuesday, October 5th at Brian McMahon High School from 5 to 7. And then Thursday, October 7th from 11 to 1 at the Senior Center in Norwalk. We'll be offering the standard vaccine as well as a high dose vaccine. And then following those 2 community clinics, like we usually do, we will hold weekly clinics at the health department. So the following Thursday, which would be October 14th, and then every Thursday following from 2 to 4 by appointment for the flu vaccine. That's also the time that we will be giving those second doses of the COVID vaccine for anybody who came to the Maritime Center and needs that second dose. So we will be filling it with, flu vaccines, also COVID. So that's kind of going to be our vaccine day, Thursdays from 2 to 4. We have the information on our website. If anybody wants to by appointment to register for those 2 upcoming community clinics, it's on our website. /flu. and there's a link to click on, and you can register and make your appointment there. I think if there's anything else. Teresa, anything I'm missing? Deanna?
No, just that if anybody has trouble making their appointment online, they can always call our blue line, which is our vaccine information line, which is 203-854-7985, or the front desk. But we know we had a lot of success last year with online registration for our drive-through clinic, and for safety and capacity and inventory. We really think this is going to work out really well. So if anybody has any trouble, though, they can always call the health department for assistance.
Thank you, Teresa, and thank you, Megan. All right, last item on our agenda is public participation. If anyone, is anyone from the public present that would like to speak, can you raise your hand?
So if someone's on their phone, I can allow them to talk if they want to unmute.
So they just have to unmute their line if they want to talk, Megan?
Yeah, just unmute their line. Maybe they just want to listen.
Okay. All right, well, I don't see anyone unmuting themselves, so it is 9 o'clock. Does anybody have anything else to bring up before we wrap up? Any other questions or comments?
Just continued thanks to the staff for the excellent job that you're doing.
Thank you, Terry.
Agreed. Very good job. It's really broad. A lot of things are going on out there, and you guys seem to have your hand on the pulse of it very, very, very well.
Thank you, Ken. Thank you, team. Amazing job. All right. Have a good day, everyone.
Thank you. You
Bye,
too.
everybody.